And now it's time for super psychologist Dr. Mara Karpel, Your Golden Years.
Good evening and welcome to Dr. Mara Karpel and Your Golden Years with yours truly tonight and every Sunday evening, 7 to 8 p.m. on Talk Radio 1370 AM. You can hear the show again by going to my website, drmarakarpel.com. That's DRMARAKARPEL. And the link to the podcast will be posted sometime later tonight or early tomorrow morning.
Please visit us on the web at www.drmarakarpel.com.
And we're back. If you're just joining us, this is Dr. Mara Karpel and Your Golden Years on Talk Radio 1370 AM and on live stream and podcast at drmarakarpel.com. And now joining us from Chicago, independent consultant whose firm specializes in helping small business owners and their families thrive even in a struggling economy. Kerri Barber is on the phone to talk about the new healthcare law and families avoiding medical bankruptcy and making most of the new law, even if you're on Medicare. So welcome, Kerri.
Thank you. I appreciate it.
How are things in Chicago tonight?
Very good. It got rather warm here, so we're happy for our summer.
Okay. Yeah. We're ready for it to cool off here. It's been 100 degrees.
Oh, yeah. We're not quite there yet.
So, Kerri, I know that you are going to talk about how people can get help in changing or taking advantage of some of the new health insurance plans that are out there. And I wanted to mention that you had hooked me up with somebody who is licensed in Texas because I'm self-insured and had really lousy insurance. And she really helped me quite a bit. I have a much more comprehensive health insurance plan, and I'm paying less for it. So thank you.
Yeah, I'd love to hear that. And that's the basic premise of when I go out and talk to people. We get the false perception that we have to be individual experts at everything, and that's just not true. There's just too much going on, especially with health insurance and the entire healthcare field. There are so many good professionals out there that you can trust and work with and use their expertise. So why not?
Mm-hmm. Absolutely. I would never have found this plan, and it was with the same health insurance company, and they never would have told me about it either. So,
right, and that's part of the challenge for people that we don't really understand or take the time to learn about how our own individual insurance works, and you don't know what's out there because the information is not going to be readily available. However, if you work with an independent agent or a broker, they can find the plan that's best for you, that's going to work for your individual situation, work within your budget. There are products out there that people aren't really familiar with, like, for example, guaranteed issue. I've gotten people covered who were cancer survivors or other major illnesses who've been dropped before, but those plans and some availability of coverage is available for those people.
So what can you tell us about some of these new plans and what's available that people don't know about?
With the advent of the new provisions coming out, which people can start to look at October 1st, these are going to be kind of the public marketplace. So you can go to healthcare.gov right now and create an account, and then on October 1st, you can start to look at what insurance companies are offering on that plan to be effective January 1. But there are private policies as well. Like, for example, here in Illinois, we have some of our major carriers, Blue Cross, United Health. They will participate on the exchanges. But then we have some other really good companies who aren't going to participate this year. So you have options, both private and on the public exchange. So that's a lot of information for people to kind of digest and understand. But what's going to be helpful about the exchanges is that all of these plans that are on there, they have to come as an apples-to-apples comparison. So one product from one company is going to be presented similarly to other products available, which makes it a little easier for the consumer to pick the right plan for them. Same goes for off the exchange, and this is where working with an independent agent can help, because we can look at both of those options with you and make a decision that's going to work best, regardless of your situation, whether you're switching from group to a private plan or you don't have insurance currently. We can help you with both of those.
So what is the exchange marketplace versus the private market?
Yeah, it's the way that I have described it to people is it's like Amazon, where it's a virtual marketplace. You log into a portal, and the first thing that's going to happen is you're going to go in and put in your information for subsidy eligibility, because the first gate that you go through, they want to know, what are you qualified for? So there may be people out there who are qualified for Medicaid or Medicare but didn't know it. So this is where that assessment's going to take place. It's going to ask for your income estimation for the following year, and this is going to determine what your subsidy will be. And what a subsidy is a government credit towards premium payments for that year. So, for example, if I get a policy that's $600 a month for my family, but I qualify for a $300 subsidy, then what happens is the government sends $300 to the insurance company, and I pay the other $300. So it's like getting a discount coupon. One thing I will tell people, I've read editorials where they're advising people, don't worry about putting in your income, just lie. Don't do that. For example, here in Illinois, where we have a hybrid system where the state is working with the federal government, they will be checking incomes, and it'll be verified based on the taxes that I file every year. In Texas, same thing, where it's a federally managed network, they will be checking incomes. And so you want to get a good, close estimate, and that'll give you your subsidy. From there, the next gate is it shows you what's available to you. So you'll either be in a Medicaid, Medicare, or in the open marketplace where you can pick and choose different policies based on what's comfortable for you. So they're going to metallic options, bronze being the least expensive but doesn't cover as much. Silver is the next tier, then gold is the next tier, and then platinum policies are going to be, the top of the line standard, but it will come at that cost as well. So people can go in and choose the plan that's going to be best for them, that's going to fit their budget, fit their family, and submit an application. So it's a one-time application that you can solicit different companies if you want to, or you just apply. One date that people really need to keep in mind is if you purchase a policy, either privately or on the marketplace, you have to submit an application before December 15th if you want it to be effective on January 1. Most people think that they could submit at any time. I've got till end of December. Doesn't work that way because the companies need time to process the applications. So if you miss that December 15th deadline, your policy may not go into effect to the end of January, beginning of February.
Right. But there's no more underwriting, correct? Right?
That's correct. Like policies that I'm looking at right now, what some companies are doing is they're still underwriting, but they're locking in rates for people who are nervous about a rate increase or things like this. For those people who choose to go through the exchange, those policies will not be underwritten for the ones that begin in January 2014. So what that means is people who had been denied coverage based on pre-existing conditions or health issues, all of that goes away.
Right.
So they will be on a more level playing field with the general public so that they can actually get full medical coverage. And for me personally, this has been a big struggle because many of the people I work with have been denied coverage before. So what we're doing is setting them up with something that is going to get them through the next few months, but we're really excited about the new options that are going to be available to them so that they can get that major medical policy that everyone else enjoys.
Right. So no more being denied for a pre-existing condition as of January, right? Of this
That's
coming
correct.
January.
And some other things is different issues would rate up your coverage. For example, if you didn't have insurance before and you were just buying for the first time, there would be an extra fee on that. Other things where gender, if you were female, you're going to be charged more. So all of those things go away.
That all goes away.
Yeah.
Okay. Excellent. Great. So, and who's eligible for subsidies?
Well, it really depends on income. The number that they've targeted is 400% of the federal poverty line or below, up to 100%. So, in most cases, if you make about $52,000 a year with a family of four, you're going to qualify. One of the best calculators that I've seen, and I actually have it on my website, is a calculator by the Kaiser Foundation out of California. And they went through with their actuarials and studied all the data and the tables, and they came with an estimator that appears to be pretty close. So if people are curious about what their eligibility might be, they can go to the Kaiser Foundation calculator. Again, it's on my website under Tools and Resources. I've got a link directly to that. But it takes some of the mystery out of it. And this is one of those things where people can start to plan ahead, start now, and take a look at what their options might be.
Right. Okay. And what can you tell us about Medicare? Are there going to be changes in that starting in January?
There are some changes coming. There are states that have expanded it. Others have not. Unfortunately, Texas has opted not to, whereas Illinois we have here. What that means is that if you were ineligible before and the state has opted to expand it, it allows a wider pool to enter into that particular market. For those people who are still ineligible, there are many, many opportunities. So I don't want people to get discouraged. For example, if your insurance right now is more than 9.5% of your monthly income, you're not going to get the penalty. There's a hardship clause built in there, so you don't have to worry about a penalty, but this is where working with an independent agent is really going to come in handy for people because we still have options. Even if, anything on the market is unaffordable for you, there are still options. Other changes, the donut hole issue. This was a big one with Medicare Part D.
Oh, yeah.
Yeah, so the new law, what it does is, in a gradual approach, starts to contribute more to the cost of prescription drugs. Now, obviously, generic drugs are still going to be the cheaper way to go, but it does provide some relief, and we're hopeful that they'll be able to negotiate that a little bit more aggressively as time goes on. But right now, by 2020, I believe it's up to 25% is what the government portion would kick in, whereas today it was at 0.
Right.
So there will be some relief there as well.
Now, with regard to Medicare, what are some important things that people need to know about open enrollment?
Well, the open enrollment period for Medicare has always been starting on October 1st. So this year we all have the same open enrollment. The difference being that the open enrollment for the new healthcare law is going to run to March, so it's a little bit longer than the standard period for Medicare. But this is still providing an opportunity for everyone to go in and take a look. They can go in and see different information based on what they qualify for. So just like the private insurance plans for major medical, Medicare also is going to have those different options available for people. So they can look at the different providers and what their portfolio of options will be. So it's going to help them as a consumer make a better, more educated choice for their family and for their budget.
So do you recommend that people have an agent help them with that as well? Because it sounds very complicated.
Well, I have a biased opinion, but yes, I do,
Okay.
because for the simple fact that I pay taxes every year, but I don't know the nuances of the tax law.
Uh-huh.
So I hire an expert. The benefit to working with somebody like me or somebody you're comfortable with is I'm not going to charge you for the time that we sit down and talk. It costs you nothing to work with me.
Mm-hmm.
So please put me to work. Put someone to work that you're comfortable with and get the best advice you possibly can, because they're going to know nuances that you may not. For example, I get emails and I get invited to lectures by all of the large insurance companies. Mm-hmm. They come in, they do talks in Illinois. I'll go to Wisconsin, I'll go to Indiana, and I'll get to really talk to them about what's coming down the pike and where their thought process is. So I have inside knowledge that maybe someone else wouldn't know.
Right.
So this is where it's really going to come in handy. And the nice part is there are so many independent agents out there right now who want to help people, want to help sort through all of this information. And this is what we do every day.
Right. And Medicare was complicated before, so.
Exactly.
Yeah.
Exactly. So this is just, if nothing else, once you've narrowed it down, it might be helpful to talk to somebody who's objective and really looking out for your best interest. To bounce some ideas off them and have that discussion.
Mm-hmm.
It can 5-10 minutes up to an hour or two. It really depends on your situation.
So, what can you tell me about avoiding medical bankruptcy? Because I know that's a big issue.
This is my personal crusade, because most people believe that I have insurance, especially group insurance, so I'm covered, and you're not. Over 75% of people who filed for medical bankruptcy had insurance, and most of them were college-educated, middle-class, hardworking people. They just didn't understand how insurance works. So there are some little things that you can do, and this, again, is where I say talk to an agent, because they'll help you figure out what your exposure is. Right. Just because you pay a premium every month, that is like your ticket to ride. That really doesn't do everything that you need it to do. So you need to know how many deductibles are on your plan, and do those deductibles cover the entire plan, or is it per family member on the plan? Because that can exponentially increase the amount of out-of-pocket expense that you have.
Right.
In addition to that, especially for group people, so if you work for a large company and they offer group, one of the protections that you are not going to have is your max out-of-pocket for the year is now unlimited. So before, where it would cap out at about $20,000, you could be spending millions. So if somebody somebody ends up with cancer or something like that, cancer is really expensive to treat. So you could be looking at losing your house, losing your life savings, and everything else just to finance the medical bills. And there are some easy ways to avoid this. Again, talk to an agent, and they'll help you figure out exactly where your plan is. But two pieces that I insist my clients have when they work with me is a critical illness and a critical accident. And we always match that up with that deductible. So if it's a family plan deductible, one deductible, I've got to match that piece so that if somebody walks outside and slips and falls, that accident is going to be covered at 100%, so there's zero out-of-pocket for that.
Right.
And these are just some really simple, very cost-effective things that people can do to cover themselves, because there's nothing worse than talking to somebody who's already lost their home and didn't know that there were some things that they could do.
Right. And I got those two pieces on my new health insurance. Because I spoke to you first, and I knew that was important. So So Kerri, I know we're running out of time, and I want to make sure that listeners know how they can contact you. You're in Chicago, but can people here in Texas contact you and get some help?
Oh, absolutely. I field calls from all over the country, and even though I am not licensed in Texas, I know people just like me who are.
Okay.
So I am happy to take phone calls, emails from anyone else, and I will put you in touch with a licensed independent agent. So if somebody wants to send me an email, Kerri, Kerri, at kerribarber.com. Phone number that they can call me direct dial is 224-829-8991. And if you're in a state where I am not licensed, again, I will find somebody who is knowledgeable, independent, objective, and they'll work directly for you. One thing that I have noticed real quickly, getting this from a lot of my clients, be wary of somebody who's giving you something too good to be true, because I am getting information that there are people out there trying to do a little bit of a scam here. So what people need to know is you need to work with somebody who's licensed, and that can be verified very easily. So ask for their national license number. 2, they should not be collecting any money, any fees for working with you.
Right.
And 3, any money that you do give forward should be directed directly to the insurance company for your first month's premium. So I can't even take a tip from anyone else.
Right.
So please be aware of that if you do decide to pursue something independently with another agent. Just ask those questions.
Okay, that's very important information. And I do know, you connected me to somebody here in Texas, and you have agents who are licensed all over the country, correct?
That's correct. Yes.
Okay.
That's correct.
So I'm going to post your contact information on my website and on my Facebook page. So if people didn't get to the pen and paper fast enough, they can check it out on my website, and it'll be there later tonight.
Excellent.
Okay.
Thank you.
Thank you so much for joining me tonight. I think, this is a very important topic.
Opportunity.
You have a good evening.
You too. Thank you.
All right. Bye-bye now.